Does size matter? Well, the guys who, tend to be really, really blessed in that area, they also tend to be really crummy at other things. At the end of the day, I think for guys that are questioning, is this important? Is it not? Just enjoy the ride, focus on being really good at the things that you can be really good at, and, you'll be fine.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin.
Back with Dr. Alex
Yes.
Tatem. We had such a good time with you last time. We had to have you come back on the podcast. So thanks for coming on again.
Thanks, guys. Super excited to be here.
Awesome, man. So let's get right into it. We're going to be talking a lot about the penis because I think that we are penis-centered people.
100%.
And that's just, we got to get into it. Yeah.
Penis-centered people.
And so I think because we 50% of the population at least has a penis, right? And even though we think about them a lot, men think about them a lot, I think we really don't understand the anatomy of them and what's going on there. So can you just give us a quick breakdown of the anatomy of the penis?
Yeah, absolutely. It's funny when you think about it that, we have, sex ed and whenever we're going through school, maybe we do, maybe we don't, right? But in reality, there's a serious lack of education about the anatomy of the genitals. That's like this shameful topic, and people are left with a lot of questions. So whenever I see guys in clinic, I try to put their minds at ease. I'm like, listen, man, like the penis is a super simple organ, all right? At the end of the day, it's just 3 tubes, all right? You've got 2 that get you erect, all right, and 1 that you pee through, which I think is a sign of, what the priority is, right? So
that's great. That's so good.
I love the way you put that.
Yeah. So, from, an erectile standpoint, I'm like, listen, those 2 inflatable tubes, they start deep in the pelvis and they go out the shaft of the penis, all right? We call them the corpora cavernosa, all right? And what's supposed to happen is that whenever guys are stimulated, they get a rush of blood into those tubes, which allow them to expand in both length and girth. And what happens is guys will become rigid, right? Because you're filling the structure, it's hydraulics. The body will actually lock off that blood flow, keep it trapped in the penis. Then you can use that for sexual intimacy. And then once you climax, pop-off valve opens back up, and then everything drains out. So I tell patients, if you can understand brakes on a car, you can understand erections. So
That was beautifully explained. That was beautiful.
The 2 to 1 is awesome.
I'm going to have to steal that.
I tell guys, like, listen, I'm not the engineer. I didn't make it. I'm just the mechanic. I'm the one that keeps it working. So,
We're all plumbers or mechanics, I guess.
Yeah. Like we're overeducated plumbers and, crackpot comedians. That's basically it.
So, all right, Dr. Tatem, our listeners want to know, what is the average penis size?
The average penis size. This is a hot topic, for sure. It's interesting. I think it's like this universal, like middle school experience for a lot of dudes where they, try to like grab their ruler and then all of a sudden, their mom's asking them like, where's the ruler? Like, nowhere. And the problem is that for most of, the population, right, that has a penis, or a large percentage of the population that has a penis, the only penis they're seeing on a regular basis is theirs, right? And so like that means that aside from that one that they're seeing in person, they're just seeing stuff online. And what you see online, what you see on the hub is not the real world. I mean, like, could you imagine, like, you're trying to like see how tall you are, but the only like thing you have a reference for the rest of the population is like, the NBA, like, draft. I mean, that's insane. So like, oh my God. I mean, that would just be like, just freaking demoralizing. Like, what, everyone isn't 7 foot. Like, oh my gosh, right. And then you pull up some, TikTok and like, then you just see some girl who's like, blue eyes, 6K finance, whatever. Yeah. But no, the average penis size is actually, only about, 5.1, maybe 5.4 inches, erect. And you can look across different studies over periods of time and see that number change a little bit, but keep that in mind. 5 something inches. That's average, right? Which also means that half the population may be above that, but half the population is below that. And so in science, we talk about this idea of quote unquote standard deviation, right? Or deviate or curve, because generally speaking, if you're looking at, a randomly associated bunch of numbers, like they are going to fall within, you've got your average, you've got the really low amount here, the guys that, in this case may have smaller penises, and guys who have maybe larger penises. And so what that means is that the vast majority of men, the vast majority of the population falls fairly close within that. So even if, God forbid, you're a guy who's, let's say, I don't know, a flat 5 or 4.9, the truth is that you're hanging out in a region where the overwhelming majority of the population is. So, don't spend all this time worrying about how big your instrument is, and maybe focus on how to use it.
Yeah. And I think that kind of is important, right? I think that at the end of the day, I think so many guys are conscious of it, and they're so fixated on their size, but does it really matter for people? I think probably not. I mean, and I think I'm going to skip a few questions, but I want to say, what do you think? Does size matter?
Yeah.
At the end of the day,
does size matter? Well, the best analogy I give to patients is like, well, does money matter? Like when it comes to, like, for example, happiness. Well, I mean, yeah, if you're starving, like, on the street, like, yeah, it's going to be a real problem trying to find like peace of mind and satisfaction. But the truth is, if you look at most incomes and most studies, once you get to about $60,000, $70,000 a year worth of income, anything above that doesn't actually increase your happiness. And so, like, if you kind of draw that corollary over to penis size, like, yeah, like you need to have something to work with. But the truth is that once you, have enough penis that it can become erect and can be used for penetration, then really anything above that is going to be really dependent on the rest of your game in bed. And most guys that I have had the distinct pleasure of working with in my job, as an erectile dysfunction surgeon, as a penis specialist, the guys who, tend to have, like, be really, really blessed in that area, they also tend to be really crummy at other things, which some of their partners will share with me quite explicitly. So at the end of the day, I think for guys that are questioning, is this important? Is it not? There's so much more to that equation of things that you can change that, dude, like, just don't stress. All right. Just enjoy the ride, focus on being really good at the things that you can be really good at, and you'll be fine.
Well, I think and we've talked about this a lot in the past, is this idea of the orgasm gap. And guess what, man? Like, a lot of women, most women actually don't orgasm just through penetrative sex.
Yes.
So if you're talking about to pleasure your partner, does your penis size matter? The answer is probably not, right? Like, you really need to be doing other stuff in the first place.
So this is a true story. So, like, we've discussed, like, in my practice, something that I do offer is, cosmetic penile girth enhancement. Right. And, the thing I commonly tell my patients, right, is there is no shame in wanting more down there. All right. But at the same time, like, yeah, I can put filler in your penis, but I can't fill the hole in your heart. You shouldn't be like, you
still that too.
Right. Like, you shouldn't be chasing this as a way to find, like, inner peace and that sort of thing. And I do my best to try and counsel patients appropriately. And I had one guy come in and he's like, "Hey doc, I really, really need this. This is like what I've been searching for such a long time. My spidey sense is starting to go off on what is this guy's expectations." And then he says, like, "Oh, hey, can you put the filler, like, in the place that it'll stimulate my wife's clitoris so she can actually come?" And I'm over there and I'm just like, bro, all right, let's bust out the anatomy textbook. Let's just start to go through this. Like, the vaginal canal is here, like the clitoris is up here. Yeah. And I'm like, man, like, you don't need, like, fallofill. You don't need, like, girth enhancement. Like, you need to learn how to give better head. Like, I don't know what to tell you. Like, guess what? And learning that's a lot cheaper than getting penis filler.
No, honestly, it's a great point. It's a great point. And educating yourself on how to, and communicating with your partner how to pleasure them better is really the key. But I do want to comment on this very interesting study about penis size where they did in 2017. One of the cooler studies is a group wanted to know, like, what an ideal penis size was. So what did they do? They went to top selling dildos on Amazon. and they looked at the realistic penises and they looked at the top selling size. It was about 6.6 inches.
So you said
on
realistic
average.
penis. So we're not talking about bad dragon. Is that
No,
right?
right,
Okay.
right,
All right.
right,
Just
right.
checking. All right. No tentacles.
But we're not talking about massive penises here, and I think that that's important takeaway too, right? I think there is such thing as probably too big, and I think that people will tell you that as well.
And I think there's something that's important to kind of point out there. So you said that the most popular size was about what? 7 inches?
6.5.
6.5 inches. And the thing is that, okay, all right, 6.5
inches. 6 inches.
Let's just say
6.6 inches. Sorry.
So if we're saying like 6.6 inches, but average is about 5.1, maybe up to 5.4, just like, let's just be very practical here. I mean, if you're dealing with a dildo, for the vast majority of people that are, holding and manipulating that, they have to have somewhere to put their hands, right? And you'll have a little bit of a base that kind of looks like a scrotum and that sort of thing. But in order to be able to have more manipulation and control as someone is holding it with their hand, you actually need 1 or 2 inches outside of the body, outside of, where you're inserting it, so you can manipulate it. So at the end of the day, what's interesting is
you're
that
pretty much there.
You're pretty much there. You're pretty much there, right? So, there's less of a gap between what is ideal and what is average than what people think.
And I think it's average for a reason.
Yeah,
right?
exactly.
Average is average because probably most people, that's what they would expect and that's what they would want, right? I think science is pretty crazy.
Absolutely. And the truth is that, if you go past like a certain penis size, if we're talking about, like sex between, straight couples, the thing is that whenever there's any sort of like trauma to the cervix, all right, like women have a very immediate visceral nauseous response. Okay. And so the thing is that average is average, all right, and you don't need to worry. Your penis size is not what's holding you back on Tinder, bro. Okay, like that is not not your problem.
It's an important thing.
Yeah.
So we've been talking about average size penises. Let's kind of go a couple standard deviations away.
Sure.
So micro penis, that term's thrown out around a little bit, So is a micro penis real?
Yeah. So micropenis is real. All right. And, micropenis definitions have kind of ranged. I've seen definitions ranging from 3 inches up to 3.5 inches, anything less than that, fully erect. And the reason why there's a range is because what we're saying is this is a penis that is 2.5 times away from the standard deviation from the average. All right. So that means that if we're looking at that bell curve that we discussed earlier, it's all the way over here on that size. And you know what? Listen, that there are those extremes, and we have at all points in our training and during our careers taking care of patients with that. And whenever they come into my office, and again, that's a not common diagnosis. All right. I have seen men who have come in my office asking me if they have micropenis, and they've got a larger than average penis, right?
100%.
And I was about to say, I was like, dude, you don't have micropenis. You just spend too much money on OnlyFans. So, but for those patients, I'm like, listen, all right, this is like, it sucks, man, and it sucks that you got to deal with this. But the truth is that there are Olympic freaking athletes that were born without legs, all right, that are world-class sprinters, all right. There are people who, become like world-class scientists in a freaking wheelchair. And so you can still become like a rock star in the bedroom, but you're just gonna have to be a little bit more creative about it, all right. So don't let this hold you back. If anything, you're gonna get really good at everything else.
I think that's just a great analogy again, man, because you're right. And listen, it exists. We've seen them in our practices, and unfortunately, there's not much you can really do for it other than counsel them exactly like the way. Listen, you have reassurance here. Most satisfaction from women is not penetrative.
Right.
Mm-hmm.
You've got to use other means, and you still can use it. And as long as you can use it, I think that there's value there.
Yeah. And, it's important to know that, cutaneous sensation, so the ability to feel touch like on your arm, your leg, or anywhere else, that actually like stops once you get about an inch or so into the female vagina. Okay. So when they talk about like the sensation with, penetration, it's very similar between, let's say, 4 inches, 5 inches, 6 inches, as far as what most female partners can actually like physically feel as far as cutaneous touch goes.
Well, I think the other thing you can do if you have a micro penis, the biggest thing you can do is actually live a healthy lifestyle, right? Because if you are fat and you have a micro penis, your penis is not going to
compounding
exist,
the
right?
problem.
I mean, let's talk about that for a second. Like buried penis, and your penis is actually not small; it's just gone. So
Yeah.
Comment on buried penis for us.
What you might call acquired micropenis, right? So micropenis is something that you're born with, right? This is a condition that is a result of a problem with development, all right? And there have been some things linked to micropenis, like certain toxin exposure, et cetera, a lack of testosterone. Maybe some people with Klinefelters are at a higher risk of it. Kallman syndrome. These are uncommon genetic conditions, but they do exist. But what we're discussing right now, which is buried penis, is unfortunately incredibly common, and it has to do with the simple fact that the length of your penis is actually the length from where it inserts deep in your pelvis out to the tip of your penis. And what happens is that when you get obese, when you start to put on weight, your penis doesn't start to shoot out your body. If anything, your body eats your penis. And it starts to expand in every other way. And all of a sudden, hey man, like from those of us that do penile implant surgery, you can have two penises that have the exact same measurements from stem to stern, but the thin guy looks like he's hung like a horse, and the fat guy, you can't even find it.
Right.
And so if you truly care about your penis, you should be doing all the things that take care of your overall health and are healthy for your heart, because both your penis and your heart are incredibly oxygen hungry organs that depend upon blood flow. And if you neglect one of them, you're going to end up hurting the other.
That's a fantastic quote. If you care about your penis, you got to care about your overall health. Right?
Absolutely. I mean,
looking for the perfect night out with your badass self, your friends, or maybe an inspirational date night? Attention all friends in Austin, Dallas, and Santa Cruz. Shameless Sex will be in you for our Who's Your Daddy tour. Join us in May for a night of edutainment where sex ed meets comedy, play, and sexy immersive experiences. Think of your favorite variety show, but shameless sex style, with special guests who will blow your minds.
Be prepared to experience something unlike anything else. Trust us, you'll leave with some great and possibly sexy memories that you'll want to hold forever. And you'll probably be holding some of our favorite sex toys in your hands. Get your tickets now at shamelesssex.com because it is selling out. Plus, if you book a VIP limited seat, you'll get a bunch of sex toys guaranteed, and you'll be sitting front row. It's going to sell out, so stop what you're doing right now and get your tickets at shamelesssex.com.
the other thing that I wanted to go back to, and we're talking about penis size, was this idea of shower versus grower.
Yeah.
Because a lot of people say it, a lot of guys will be like, I'm a grower. I'm a grower. So, you're in the locker room with the boys.
Yeah.
Are we going to go around right now?
Yeah. So
what's your thoughts? Is shower and grower real? Can you be a shower or a grower?
Yeah. So what we're really talking about is this concept of penile elasticity. Okay. Like, how does the penis stretch? And so it's really, really interesting. If you actually do a cross section on the penis, the erectile bodies themselves actually have two layers, the corpora cavernosa, those cylinders. You have the outer longitudinal layer. Okay. And what happens is those fibers are running up and down the shaft of the penis, so that whenever the guy gets erect, he's going to expand in length. And then the inner circumferential or circular layer of fibers, so that guys will expand in girth. And so a healthy penis, I tell patients, is a stretchy penis. All right. So that means that whenever you come out of, let's say, the worst possible scenario, right? For me, that's going to be coming out of the Indiana winter, right? Or another one that everyone can sympathize with, which is getting out of the pool. All right. So that is going to be like the worst case scenario. All right. But if you apply gentle traction to the head of the penis and start to try and stretch it, it should be stretchy. It should be elastic. And so when we start to talk about, showers versus growers, we're talking about that concept of penile elasticity. Now, for some people, that is more pronounced than others, right? So there was a study that was done by, our colleague, Dr. Yaffe, back when he was with, Wayne Hellstrom in Louisiana, where what they saw is that men that had a change in size of over 4 centimeters, they called growers, right? And this was resting testing at room temperature, all right, and then compared that with fully erect penises. But what's interesting is if you look at that, who were more growers? The younger, healthier guys, right? So what I tell patients is like, listen, ultimately what matters, it matters your full erect length, all right? And if you want to maximize that, take care of your health, dude.
Yeah, I think about 26% of them were growers. So it seems that most of them were showers, but I think the age point is really, really important. And then the elasticity of your penis is a health measure, because you're right. Anytime, especially when we're looking at penile function and erectile dysfunction, when we're doing exams, we're always looking at stretched penile length, which is often our surrogate for erections. And we're always noting, or at least I'm always noting, I'm sure you guys are too, is it stretching appropriately?
Right.
Is it feel scarred? Is it feel a little bit fibrosed? And that is a great sign of what's going on.
Yeah, I mean, listen, if you're examining a patient and when you apply a little bit of tension, if the poor patient starts to fall on top of you, that's not the sign of a healthy penis. And so, another thing that patients ask me about is, okay, all right, well, if a stretchy penis is a healthy penis, should I quote unquote be stretching my penis? And what I tell them is, number one, okay, you need to stay away from this concept of jelqing, which is like manually pulling on your penis, because that's actually introducing trauma that could put you at an increased risk of injury to the suspensory ligament. So that ligament that holds your penis in place whenever you have an erection and prevents it from moving left to right or down too much. All right. Or you could actually cause Peyronie's disease because of that injury. Now, if you are, let's say, super, super motivated, all right, and you're like, man, I just need that extra half centimeter. We are all familiar with the concept of traction therapy, which is something that is very, very different. This is not sudden traumatic yanking on your penis. These are medical grade devices that you go ahead and apply to the penis that then gently starts to pull the penis with a safe amount of tension over a prolonged period of time. And we know that men who use traction therapy will add a little bit more penile length. Now, it's not going to, give you a second career in the movie business, so to speak, but it is incredibly powerful, especially for men who have had a major health crisis like radical prostatectomy, where they've undergone a cancer surgery and they may have a compromise to the health of their penis as the result of that. And so traction is great in those circumstances. And also healthy patients, they can use traction too.
I mean, we just did that myths episode on joking, and I think Dr. Tatem explained it a lot better than we did.
Yeah, man.
I will tell you another interesting thing, right? So if we're talking about how can we maximize health of the penis, so something that we all encounter in our practice are guys who are kind of sort of like biohackers, people that are extremely motivated to try and maximize their health as much as possible. And, we're getting to this paradigm where we're starting to be more proactive in our health. And I don't think it's unreasonable to take that same approach when it comes to the health of the penis. And so, for example, we know that daily PDE5s, like daily tadalafil, are extremely safe. Yep. We have really good data, out of, for example, what John Mulhall has done with prostate cancer survivors, that daily PDE5 can help preserve erectile function. It can help maintain penile size. And so for those really motivated patients, I commonly prescribe daily Cialis.
100%.
I mean,
100%.
We often joke, right? Just put it in the frickin' water.
Yeah.
And I am not ashamed to say that I'm a 37-year-old man and I'm on daily Cialis, because why not? I care about the health of my penis, and these are some of the safest medications that have ever come out.
Yeah, and one thing that I do get a common question about this, because some people say, "Can you put me on the daily Viagra, sildenafil, because of the data on Alzheimer's association?" Now, for me, my stance is, I think the daily Cialis is better in terms of penile function and improved blood flow because of the half-life of the medication. I think it obviously lasts longer.
Yeah.
Viagra lasts maybe 8 hours if you're lucky.
Yep.
But the difference in terms of will Cialis, impact Alzheimer's and stuff like that. Interesting enough, I did a dive into the literature. Cialis does not cross the blood-brain barrier where Viagra does. So there is, if you're looking into that benefit, the data has suggested Cialis doesn't
cross that barrier.
Yeah. So I'm not sure that that's going to be the reason why we should be it, right? It's an association. It's not a causation.
Yeah.
But I I still recommend the daily Cialis.
Yeah. I think we've seen data presented at the conference we're at right now that has shown that daily PDE5s decrease the incidence of major adverse cardiac events. And you and I were talking off camera. We were discussing my own health issues with blood pressure and that sort of thing. And so really trying to maximize your health through every possible means, I think is totally reasonable. But you have to understand that the majority of the work is going to come in regards to your lifestyle. So your diet, your exercise, your sleep, trying to minimize stress in your life, all of those things. And then, all right, you do all that, then yes, we can add in very judicious use of medications that have been shown to be very, very safe.
Yeah. I mean, one final comment on that. I think that when we're talking about medications, I think when we handle how we relate this to our partners is important as well. Because if you explain it from a perspective like you just had, and you say, hey, listen to your partner, you say, listen, it's not necessarily have erectile dysfunction, or maybe I do have a little bit of erectile dysfunction. I want to perform so that we're both happy and living the best life. It has nothing to do with you.
Yep.
I think that's important, right? Because the last thing, guys, I think sometimes worry about is their partner's going through their medicine cabinet and they go, what the hell is this, right? What the hell is this? You've been using this on me?
What's this for?
Where is she?
Yeah. Exactly. So I think that for many guys, they may be embarrassed, but that communication is also important for the relationship.
Yeah. And, it's something that is, hits at the heart of every guy. I'm not immune to, that sort of, stress or anxiety. So I'll tell you that recently I went to a new doctor's office for something totally unrelated. I was, getting something looked at, on my freaking foot, and they're taking a medication history, which is a totally normal, healthy thing. And all of a sudden, I've got this MA in there who, of course, is this young, 20 something, first job. And she's like, okay, so I see here you're on this, so some blood pressure medicine. So we got some some high blood pressure. Oh, and so daily Cialis. So we've also got some erectile dysfunction. I'm like, God damn it. It works amazing. Thank you very much. Yeah. I'm dialing up my wife. I put her on speaker. I'm like, honey, tell her.
Get the evidence.
That's awesome.
Oh, that's awesome.
Mm-hmm.
I want to pick your brain, actually, Dr. Tatem. So, you talk about taking a daily Cialis.
Sure.
What are your opinions on supplements that could improve erections or help your penis?
Yeah. And so, it was something that I was originally very skeptical about because, let's be honest, when it comes to the supplement market, it doesn't have the same level of oversight as medications. We don't necessarily have the same amount of robust data. That being said, fortunately, we are starting to get more and more data. And what we do see is that medications that improve nitric oxide release can improve erectile function. And so I think the one that the two that we're most familiar with are going to be L-arginine and L-citrulline.
Yes.
All right. I have a real bias towards L-citrulline simply because it actually is converted to L-arginine in the kidneys and has better oral bioavailability. But this has been shown to be so effective that actually men that take L-citrulline in addition to their daily PDE5 are going to get a better response. And it's something that is so compelling. We've actually made it part of our prostate cancer survivorship program. So our men that are going in for radical prostatectomy to save their lives, to take out the prostate cancer, but they also care about their quality of life, we start them on a handful of things. 1, daily Cialis. 2, twice a day, 1,500 milligrams L-citrulline, all right? And then in addition to that, we start them on a vacuum erection device, again, trying to get that penile stretch because they are going to, at least temporarily, lose spontaneous erections, and especially those nocturnal erections that we know are so healthy. So yeah, supplements can help erectile function, but they can also make you all flush and everything, which is why, I look like a freaking beat every time I take pre-workout, right? Because you're just dumping that, L-citrulline in your body and you're getting vasodilation everywhere. Yeah.
It's a great answer, and I do definitely agree with you on those two. I think L-citrulline is something I have actually taken before. I've truly
Yep.
felt the difference is 100%.
Yeah.
Just taking L-citrulline.
Yeah, and what's interesting is that blood flow, like our bodies are just so dependent on oxygen, and whenever you deprive any organ system of that, you're going to have a profound contraction, a profound loss of health. So as surgeons, right, we see that when it comes to something like radiation. But what's interesting is that when you look at the opposite of that, what happens when we improve blood flow to something? So for example, there's a condition called radiation cystitis, which is a terrible condition for cancer survivors, where they actually get blood in their urine and they have really irritable like urination symptoms. And what we found is that putting those guys into hyperbaric oxygen therapy, where we actually force oxygen to perfuse tissues where it may not just here at like regular like altitude pressures, they get a profound increase in the health of that tissue, and they can see a big improvement in their symptoms and their quality of life. And going back to the topic of like training in the gym, so there's really good data that shows that PDE5s like Cialis and Viagra improve muscle pumps and improve hypertrophy.
100%.
Yeah.
We, all the weightlifters are pretty much on that, like the serious guys, for sure.
Absolutely.
100%.
Yeah.
Let's ask the big question that you always see when people are talking about shoe size.
Yeah.
I'm a 10 and a half. I'm not that small, by the way.
Yeah.
They say big feet, big dick.
Yes.
Now, is there any data to support this?
Yeah. So as a guy wearing a size 12 and a half boots right now, I have to say
there is
there's
he's laying it down. He's just laying it down. I'm a 10. I'm a 10.
So yeah. So the sad truth, is that no. So shout out to all the girls that look for shoe size on a Bumble, but no, shoe size and penis size do not correlate.
That's you heard it here.
There you go. You heard it here, folks. So, it's interesting that in my job, right, like I probably see about like, I don't know, 30 to 35 guys a day. And a lot of them, I'm doing physical exams on because we're talking about the health of their penis and you have to examine them to check that out. And, the truth is that there's no substitute for that physical exam because you have no idea what you're going to find. No freaking idea. And so I will tell you that I have tried to like guess because I'm like, man, like, I should have a sixth sense of this right now. I have at this point in my life touched thousands of dicks. All right.
Probably hundreds of thousands.
But honestly, the truth is that I have no idea. And I always find it hilarious whenever I am so far off. And, I've got this like
pleasant surprise.
Yeah. I've got this, this, kind of short, like, elderly 80-something-year-old guy, prostate cancer survivor. And I come out and I'm like, how do you wear shorts? Yeah. So, oh, Lordy.
All right. Well, there you go. That's a myth right there, right?
Yeah, it is officially debunked.
Debunked. All right. So let's talk about another thing. Why do men get morning wood?
Morning wood. Well, it's really more accurate to say like nighttime wood or nocturnal wood, because what happens is when we sleep, all right, our body starts to go into a rest and repair phase. So if you think about how our body sends signals, okay, it does it through a bunch of different mechanisms, but the major one is the nervous system. And so out of the nervous system, there are two major classifications. There is what's called the autonomic system. Autonomic kind of sounds like automatic, so that's the way I remember it. That's all the stuff that happens without our direct input, all right? And then we have the somatic, which is the stuff like moving my hands and that sort of thing. So the automatic rest and repair cycle involves activation of what's known as the parasympathetic system when you're sleeping, all right? The sympathetic system is the contrast to that. That's when, you run away from a bear, all right? So when you are resting, what your body wants to do is it wants to perfuse all tissues, carry away toxins. Rest and digest is the phrase that we learn whenever we're going through medical training. And part of that activation of the parasympathetic system involves dilating blood vessels, including dilating blood vessels to the penis. So when you're in, the most restful restful part of sleep, or an essential part of sleep known as REM sleep, so rapid eye movement sleep. And it's called that because whenever you actually track eye movement with people's, with special machines that you can actually do to look at eye movement, even with people's eyes closed, eyes kind of move back and forth. But that's a critically important part of sleep. And whenever you get into that part of sleep, the body will allow for vasodilation, which is then correlates with erections. And on average, men should be having about 1 erection every other hour while they're asleep. So if you're getting 6 hours of sleep, that's going to be 3 erections, 10 hours, 5 erections, give or take. So again, take care of your body, take care of your penis, right? 5 erections sounds like more than 3, right? So isn't that better? So again, prioritizing sleep actually can help the health of your penis as well. So why do you have morning wood? Well, because you're getting wood whenever you're sleeping and you just happen to wake up during one of those REM portions and you still got a woody.
I also think part of it has to do with the early morning levels of T.
Oh, yeah. So the hormonal part.
The hormonal part, too. I think that those higher, our levels in the morning are highest than they are. So I think that's why guys are horniest in the morning. And they can get that little extra boost in the morning, too, I think, in terms of hormonal levels.
So you're saying because I'm on injectable T right now, that's why I'm horny all the time?
Correct.
Okay,
correct.
all right.
So
got
you
it.
actually you just have fully hard all the time.
wood.
Yeah, exactly. I'm just ready to fucking go.
So I think the last question, and I think we've kind of been talking about this, but can lack of sexual activity actually shrink your penis, right? The old adage is if you don't use it, you're going to lose it.
Yeah.
So can you lose it if you don't use it?
There are a lot of misconceptions here that I think are important to clear up. So the phrase use it or lose it is true for a lot of different things. Now, when it comes to the penis, all right, no, if you're not getting laid every other week, dude, your dick isn't getting smaller, okay? All right, that's not the problem. But let's say that you're not getting erections anymore, right? Because the truth is that's what really matters, all right? You need to get perfusion of that tissue, means blood flow in that tissue. You got to get that stretch. So if that's taken away from a patient, let's say as the result of cancer treatment, all right, as a result of hormonal problems, all right, or maybe some injury, then yeah, you have decreased blood flow to tissue and you're going to get atrophy. And so if we look at this at men who are the most extreme example, let's talk about guys that are totally potent. These are guys that get excellent erections and then they go in one day and they have to get their prostate out for prostate cancer, all right? Well, the thing is that if they don't do anything to try and maintain their penile health afterwards, they can lose upwards of 2 to 3 to 4 centimeters off their penis in that first year. And taking a couple centimeters off a penis, I mean, that's a big freaking deal. A couple centimeters off a penis is like taking 20 foot off a boat. That's the difference in between a yacht and a dinghy, all right? So yeah, if you care about your penis, if you care about your sexual health, and that doesn't necessarily mean that you care about it in the moment. Maybe you're going through a health crisis, but you know that you're going to care about it again, then, try to find a sexual medicine specialist. Try to find somebody who cares about the quality of life issues that you care about and, get some help, all right? Because we have a lot of fantastic options to get you through that tough time, that period, and, hopefully maybe even restore your sexual function in a way that prevents that further loss of size.
I think that was a perfect way to end that.
Yeah, man, for sure.
Yeah. And this is why Dr. Dubin's going to be doing my implant next week.
Yeah. I mean, your heart is a rock for the last 2 years, so I think you're good. Let's fucking go. But thanks again, man. This is always amazing.
Yeah, man,
to have
so
you
much
on.
fun.
It's always fun, and you make it so approachable and so easy to understand. And these are not necessarily easy topics to talk about or explain.
Yeah.
Where can our listeners find you as always?
Yeah, so if you want to check me out, you can find me on Twitter, Instagram, Dr. Alex Tatem. But if you want to check out our practice website, go to menshealthin.com, menshealthin.com. And we've got a fantastic team at my practice, Urology of Indiana at the Men's Health Center. I've got some of the best physician assistants in the game. They're absolute rock stars. I'm so proud of our team. And we'd be happy to take care of you.
All right, man.
All right.
Thanks for coming on,
so
man.
much,
Thanks
man.
for listening, guys.
Thanks, guys. Appreciate it.